Right. So, good evening, everyone. My name is Jessica and I work for Medtronic. Tonight, I have the pleasure of hosting this webinar where you'll get to hear from Dr. Elizabeth Takacs and Dr. Stephanie Pothoven, who are part of the team from the Urology Center of Iowa. Dr. Takacs is a board certified urologist with subspecialty certification in urogynecology and reconstructive pelvic surgery, URPS. A proud Iowan, she brings decades of experience and a deep passion for advancing care for women with pelvic floor conditions like incontinence. Dr. Pothoven is a board certified urologist, and she was drawn to urology by the wide spectrum of urologic conditions and balance between clinical and surgical medicine. She recognizes that each patient is unique and enjoys helping patients to understand their diagnosis and individualizing their care. Both of our presenters have a special interest in treatments for overactive bladder, and they look forward to discussing this more in detail tonight. Just a reminder, as I mentioned, if you have any questions, please use the Q&A box or the chat function, and we will answer those at the end. So welcome, presenters. We're excited to have you.
Great, thank you. So as Jessica mentioned, I'm Elizabeth Takacs. I'm from Iowa originally. I grew up in the northern part of the state. I've done my training throughout the state and then residency in New York and Texas. I've been with the Urology Center of Iowa now, I think about 5 months. I've been in practice close to 19 or 20 years, and urinary incontinence has been really one of my passions throughout that time. So I'm excited to be able to share with you a lot of the wonderful advances that I've seen come along through my 20 years of practice.
And hi, I'm Dr. Stephanie Pothoven, and I am also an Iowa native from Northern Iowa. And I have been practicing here in Des Moines area for almost 15, more than 15 years now, actually. We've been part of Urology Center of Iowa since its initiation 6 years ago. And my practice is predominantly female pelvic medicine, incontinence, and prolapse surgery. So I'm excited to talk about overactive bladder and treatment options with you tonight as well.
We also do have some other people on our care team that also have an interest in overactive bladder, both Dr. Brian Gallagher and Dr. Brian Schulte, who are not with us tonight, but they also see a lot of patients, especially men and women who have symptoms of overactive bladder and help serve those patients and provide treatment opportunities.
So bladder and bowel issues are common. Let me see here. Sorry, technical difficulties here. Oh, I have a touch screen, so that'll. So it's important to know that incontinence is not something that's inevitable. It's not just a normal, natural part of aging that we just have to put up with and deal with as we get older. Certainly it becomes more prevalent as we get older, but that doesn't mean it's something that we have to live with and deal with. So there are many treatment options available, and there are many reasons that we can be prone to this. There's things that you may not have thought were possible, like talking to your grandkids, taking them to lunch, sitting through a whole baseball game or a whole basketball game, enjoying a good night's sleep or an entire movie. So these are all things that are possible if we can treat some of these conditions. So many of you might be feeling concerned, exhausted, overwhelmed by these symptoms, but you maybe have been too embarrassed to talk about it. Embarrassment is a real issue and a real concern for many patients when we're talking about bladder and bowel issues. So you're not alone, and just know that Liz and I, as well as Ryan and Brian, we see many patients every day that have bladder and bowel concerns and incontinence issues. So you're not alone. It's not something that you can't talk about. Certainly it can be embarrassing, but we're here for you, and we're here to talk about it and to get you the help that you need. So if we're looking at prevalence of both bladder and this treatment also helps with bowel control as well. Nearly 43 million adults suffer with bladder control issues, whether that be urgency and frequency or urgent incontinence. It can affect your social life. It can be embarrassing. It can limit you from going out and doing the things that you enjoy. About half of that number of patients, about 20 million, also report bowel control issues and fecal incontinence. And we're excited that we can talk to you about treatments that can help these conditions. Even though as we get older, the risk of these conditions increases, it doesn't mean it's something that we just have to accept and deal with. It's something that we can absolutely treat.
So ultimately, what causes bowel and bladder control issues? There's any number of things that contribute, but there are some simple things that we start to think about. Are there daily habits that are contributing to your symptoms? This includes what you eat and drink. Are there medications or supplements which may be making you make a larger volume of urine or making your stools looser? And then there's things like pregnancy, childbirth, and pelvic floor injuries that also may contribute to some of the symptoms. What's important is when your body is functioning properly, the brain and the nerves to your bladder and rectum are in correct communication and being able to communicate when things are full and when things need to be evacuated. So ultimately, the good news is if you experience either bladder or bowel symptoms, there are things that you can do to help find relief and to get control back into your life. We're going to go over first how the bladder and bowel control works, but then we will explore the different treatment options more in depth. So how do the bladder and the bowel work? So brain and bladder bowel communication is critical. So as your bladder fills, it's going to send signals up to the brain saying, I need to go to the bathroom. I'm kind of needing to go to the bathroom. And the brain is going to be sending signals back to the bladder that says, yes, you can in fact go to the bathroom, and helps to do the neural control to make you urinate or to defecate. But at times also the brain is going to send signals back to the bladder to say, oh, you're in the frozen food section right now. It's not really a good time for you to be emptying. So I'm going to make you hold on to that urine and bowel for a while longer. And it's when that communication breaks down that people start to have issues with how their bladder and their bowels are functioning. There are a lot of different therapies, as we mentioned, and the Medtronic sacral neuromodulation is one of those that helps to restore that communication. So as we've mentioned, common bladder and bowel problems are common, and there are some simple ways to help address those.
So one bladder control issue is what we call stress incontinence. And we're briefly going to talk about this. The majority of our talk tonight is going to be about overactive bladder and urgency and not being able to make it to the restroom. But what stress incontinence is whenever there's external pressure or stress on the bladder, like when you cough or sneeze or laugh, or it could be as simple as just pushing yourself to stand up out of your chair can cause that urine to leak. And that can definitely impact your life, impact the activities that you want to do. And there's many different treatment options for that, from exercises and strengthening those muscles that control the urine and the pelvic floor, physical therapists that can kind of really help augment that. And we have surgical procedures that we can do to restore that support to prevent that stress incontinence. But that is something, a whole pathway separate from our overactive bladder talk that we can certainly talk about at any point at an appointment or down the road if stress incontinence tends to be a primary issue. The next thing that we'll talk about is urinary retention. And what that is when the bladder isn't able to empty, whether it be from a bladder not being able to squeeze well enough or hard enough to fully empty, or if there's some kind of an obstruction or blockage, such as an enlarged prostate in men, or in women, if you have a significant prolapse, that can cause kinking of the urethra, the tube that the urine drains through, and that can cause the bladder to not empty very well. So when you have retention, we want to make sure the bladder can empty. If the bladder isn't emptying very well, that can lead to a lot of symptoms, including having to go a lot more frequently, because if only you empty a little bit at a time, it doesn't take very long to fill back up, and then you're having to go again. Urine that just sits in the bladder is a great place for bacteria to grow, so that can lead to problems with urinary tract infections. And over time, as the bladder continues to get stretched and never emptying, that can just lead to further further issues with bladder function. So retention can happen. And patients, when you're holding on to a lot of urine in the bladder and it's chronically stretched, sometimes you may not even have that full sensation that the bladder's full. So this is something that we would evaluate in the office. We would check an ultrasound scan to see if your bladder's emptying very well. But this is something that can definitely be treated as well.
So I think one thing that's important when you come in to see us or another provider regarding your urinary symptoms is we're going to ask you a lot of questions about your bladder, questions that you probably don't think of. And what we're trying to determine is based on your history alone, what type of incontinence or what factors may be playing into causing your leakage. And we really want to try to differentiate stress incontinence or urinary retention or incomplete bladder emptying from patients that have more true overactive bladder. And as Dr. Pothoven mentioned, the symptoms can sometimes seem similar. Overactive bladder is when you find that you have to go to the bathroom frequently. Typically, most people avoid on average 6 to 8 times a day. So if you're finding yourself going to the bathroom 10, 12, 14 times a day, that meets the definition of overactive bladder, as well as having a lot of urgency. That sensation of having to urinate and not being able to get to the bathroom fast enough before you have leakage. That sensation of having the urge to go, but not being able to delay for 5 minutes before you start to experience leakage or a lot of discomfort. And so with those symptoms, that's how we define what overactive bladder is. We will also ask you a lot of other symptoms, such as, are you using pads or protective garments? How many times may you be getting up at night? Are you able to reach the toilet at night? Just all trying to explore and document what some of your symptoms are so we can assess impact as we move forward with the different type of therapies. Another type of incontinence that's not necessarily related to the bladder is fecal incontinence or loss of stool. Fecal incontinence occurs in many different forms or varieties. It could be having some urgency and not being able to reach the toilet before you have a bowel movement. It can be loss of stool without awareness. It can be loss of solid stool or loose stool. And it also can be what we call fecal smearing, which is kind of staining of your underpants or your protective garments. So again, some of the therapies we will talk about tonight can also help us address fecal incontinence. So there are a lot of different things that we can do to help you find more control and regain confidence in your life. So generally speaking, we have what's kind of conceptually is called a bladder care plan. Within this bladder care plan, you come in, you meet with your providers, you determine what type of incontinence you seem to fall into. Some simple testing may be done, such as a post-void residual check to make sure that your bladder is empty, or a urinalysis to ensure that you don't have an infection or blood in the urine, which may need further investigation. But things that we'll start to focus on, even in that first visit, are there lifestyle changes that need to be considered? Are you a patient that is not really voiding very often and we can maybe help you by just more regular urination? Are you drinking a lot of caffeine, carbonated beverages, which we know can directly irritate the bladder? Or are there medications in your history that, though we may not be able to change them, we need to be aware of and take into consideration? And one of the most common ones, medications that cause exacerbation or worsening of symptoms, are diuretics. Diuretics make your bladder symptoms worse, not because they are directly affecting the bladder, but because they are making you make more urine. Therefore, you're filling up your bladder faster. Beyond lifestyle and changes in medications, we have a whole number of different therapies, ranging from ankle stimulation, Botox injections into the bladder, versus sacral neuromodulation. And while we call these procedural-based therapies or advanced therapies, we will work with you to make what we call shared decision-making. And this is really looking at all aspects of your life and having a conversation with you to decide what is the best option for you as an individual patient. I talked a little bit about lifestyle changes. This can be working with diet and exercise. It can work on bladder and bowel retraining where you try to suppress the urge and then delay going to the bathroom. Sometimes working with physical therapists is very important, either to help improve and strengthen the pelvic floor. But actually, sometimes what we find is that patients have very tight pelvic floors and we need to lengthen or loosen them. Just like if you have a knot in your neck muscles causing you a headache or neck discomfort, you want to massage out that knot. So sometimes patients have a very tight pelvic floor and we need to get that pelvic floor relaxed. Oral medications are another common treatment. These may be started even through your primary care provider, but oral medications don't always control symptoms. They don't always give us what we want as far as our goals and objectives, but they also can have side effects. Some of the challenges with medications is they need to be taken regularly, and there can be some issues with long-term compliance and patients wanting to continue this for years and years and years. There's also, unfortunately, the cost of medications. While we know that some medications are better tolerated, have a less side effect profile, these medications can sometimes be expensive, and so patients just simply cannot afford them. And then there are medication side effects such as dry mouth, blurry vision or dry eyes, constipation. And so many patients have those symptoms at baseline from other medications, and so we may worsen some of those side effects as well as high blood pressure.
So what do we do when the conservative, early, easier things don't work? When we try to do behavior modifications, dietary modifications, when we've tried the medications and either they don't work, they start working and then kind of taper off and aren't working as well as they used to, or you can't tolerate or afford them. What are some of our next steps? We call these advanced therapies. And there are several different options, and there's nuances to each one, and a lot of figuring out which option to proceed with will depend individually on your symptoms and your goals. Medtronic systems that we use, one is called an interstim device, and that is when we stimulate the sacral nerves, because the sacral nerves are the nerves that control bladder and bowel function. So sometimes doing some stimulation treatments to the sacral nerves can help to reduce that overactivity of the bladder and the bowel. It can calm that down and help to kind of restore that brain and bladder nerves communication. The AltaViva device, it's a tibial nerve stimulation device, which is placed in the ankle. And that is a branch off of the nerves that go to the bladder to the sacral nerves. So stimulating just peripherally the nerves down even into the ankle can sometimes result in improved nerve connection between the bladder and the brain. There's nerve treatments that we do in the office where you just come in once a week. That's not implantable. That's a little less invasive. And then we also have medications that we inject directly into the bladder that can help. As far as bowel control goes, typically that's just treated with stimulating those nerves. So Botox injections is one of the treatment options that we can offer. And what that involves is coming into the office or surgery center. We look inside the bladder with the scope, and inside the bladder, we just inject a very dilute Botox solution into several different areas throughout the bladder muscle. And that targets the bladder muscle itself. It doesn't target the communication between the bladder and the brain. This is just directly working on the bladder muscle itself. And this can help to relax that bladder. Now, one thing that can happen when we do this injection, if we relax that bladder too much, there's potential that that could make the bladder not empty very well. If the bladder is holding on to a lot of urine, it may require catheterizations following the procedure, where that would be something that you would do at home 2 to 3 times a day to help the bladder empty until that Botox starts to wear off, and then the bladder emptying restores itself. The Botox injections are temporary. It's not a one and done treatment. Average amount of time that the Botox lasts, just like it in cosmetic world, the Botox only lasts a certain period of time. So average for the bladder is about 6 months. I have some patients that have bad, maybe neurogenic bladders from a spinal cord injury or something like that, that may have more severe symptoms, and we have to do it every 3 months. I have some patients that can get almost a year out of one injection. So everybody's going to be a little bit different in how they tolerate and respond to this. But this is a good treatment option. It's something we certainly do quite a bit of here. This only does work on the bladder since we're injecting it directly into the bladder. So this does not help for patients that have bowel incontinence, or many patients we see have combined bladder and bowel incontinence, because it's those same nerves that are controlling it. Percutaneous tibial nerve stimulation. This is a treatment that we do here in the office, and it's a nice segue into advanced therapies. It works very well. It's typically once a week for up to 12 weeks. And it's just a 30-minute appointment where it's almost like a little acupuncture needle that goes by the tibial nerve in the ankle. And then that just has a little electrical stimulation to it that quiets down those abnormal signals between the brain and the bladder and helps restore that normal nervous control. So this typically works well for patients that have urinary urgency, frequency, and urge urinary incontinence, where you just can't get to the bathroom quick enough. Following those 12 treatments, if you do respond well to this, we would continue maintenance treatments about every 4 to 6 weeks, where you'd come in for one treatment. So it's a good treatment option. It is a little labor intensive as far as the number of office visits. But it's nice to see if you respond well to this therapy to try some of the office treatments. So it's certainly a good option that we frequently will utilize. And a step off of that percutaneous tibial nerve stimulation, we now have a tibial implantable device where it almost looks like it's about that long and about that wide, and it just is implanted just down in the ankle right next to that tibial nerve. And it has a battery within it, and it just keeps a constant stimulation, or it keeps a constant stimulation to those nerves that is programmed, that will go off periodically throughout the week to stimulate those nerves and try to restore that communication without requiring such frequent office visits to have this done. And the batteries last up to 10 plus years with these implantable devices. So it's an excellent treatment option for patients that either can't tolerate the medications or afford the medications, or when the medications don't work. It's an excellent treatment option if someone has tried the office-based treatments and respond well to it and want something more of a long-term permanent solution. So it's been a great addition to our treatment armamentarium.
So the last advanced therapy is sacral neuromodulation. And when we talk about the advanced therapies, I'm going to say that sacral neuromodulation has been around since around 1999, 2000, and was really one of our first therapies beyond medications for patients with overactive bladder and fecal incontinence. So what sacral neuromodulation is we're targeting, again, the nervous system of those sacral nerves that go to both the bladder and the bowel. And what's important to note is placement for bladder dysfunction and placement for bowel dysfunction is exactly the same. So what we do is you have to go through a test period, and it can be performed in a number of ways. But ultimately, if it's successful, you have an implant placed onto your backside. It's important to realize this is not going into the spinal cord or near the spinal cord, as it's placed external to that, but underneath the skin. And the battery usually sits at about where your pants pocket is located. And what is important is a lot of patients think of batteries of pacemakers and how they project out of the wall on the chest. When we place the battery for sacral neuromodulation, you may feel it if you press on the skin, but you're not going to necessarily see a notable ledge or projection from the skin. There's a couple of different options. There's a place it and you never have to charge it, and that battery lasts around 10 to 15 years. But there's also a rechargeable option that may be better for some patients, and it's going to have a slightly longer battery life. And especially if patients are very petite, a rechargeable device may be a good option for them because the battery is considerably smaller than the typical rechargeable. So as I mentioned, you have to test or evaluate the lead first. Oftentimes, we will do what's called a PNE, and this is done in the office or surgery center under local. So we just inject some lidocaine along the tissue on your backside, along the bone of the sacrum, and we put some small leads in. Excuse me. You then live with those for around 3 to 7 days. Typically, if we can make it to the 7-day mark, we prefer that. And during that time frame, you're recording the number of times that you're urinating, having accidents, and we really want to see that you have greater than 50% reduction in your symptoms. If you've achieved that 50% reduction in your symptoms, we will then go to the OR either under a heavy sedation like a colonoscopy or a general anesthetic and place a permanent lead as well as the battery underneath your skin. The important thing with both the AltaViva as well as the sacral neuromodulation is you still can have MRI scans done should you need to. Now, if you're a patient listening tonight that has an older device, this is something that has new throughout the evolution of sacral neuromodulation. It's kind of evolved from no MRI to head-only MRI. But now, patients with the newer system since around 2020 or 2019 can confidently have an MRI of their head to their toes with the device. You do have to put it into a special, what we call MRI mode. But as a patient, you have the capability of doing that, and it does not necessarily require a visit to your provider. So the Medtronic sacral neuromodulation system is effective. Approximately 84% of those who use it for bladder control are very happy or satisfied, and they've had 3 times greater improvement than just medications alone. I think one of the important things to emphasize is when we talk about the definition of success with any of our advanced therapies, we're talking about greater than a 50% improvement in the number of pads that you're using, the number of incontinent episodes that you're having, or reduction of the number of times you urinate. So it's not necessarily going to get you to be able to go 5 hours without urinating and sleeping through the night when you go to bed and sleep for 12 hours. But even for patients, they are very happy when they've had over 50% reduction in symptoms. 89% of the patients who use the Medtronic device for bowel control have had long-term success. So throughout the 25 years, over 450,000 patients have been impacted positively by sacral neuromodulation. And I think with the advancement and development of the AltaViva device, we're even going to reach more and more patients. So one thing that is available even to you today is something called the My Future app, which is available through the Apple or Android store. This is the first step in really understanding what some of your bladder symptoms are. This is avoiding diarrhea. Avoiding diarrhea is something that Dr. Pothoven and I will do often for patients because it actually can give us some more objective information to sometimes a situation or symptoms that you haven't really thought about often. And we use this information to help guide therapy as well as have an understanding of how you've responded to the different therapies. So this is something that's available to you as early as today to download and walk through and start using.
So which therapy is right for you? So the answer to that is different for every individual patient. And it's something that we can certainly sit down and talk with you about, go through in detail all the pluses and minuses of all the possible options that we've talked about tonight, and really tailor the treatment to your symptoms, your needs, and your goals. So if you have significant symptoms, like we talked about, going more than 8 to 10 times per day, if you're leaking urine, having that urgency and, oh my goodness, I can't make it to the bathroom in time. These are the patients. These are the things that we can do to help. If you've tried lifestyle changes, you've modified your fluid intake, you've modified your activities, and you haven't found any relief with that. If you've tried the oral medications and that hasn't worked out, whether it be lack of efficacy or intolerable side effects, if you've tried these other things, we're not at the end of the road. We have lots of options for you, like we talked about tonight. And unfortunately, a lot of patients aren't aware of these options. So we want to get as much information out there as we can, because we want to help everybody that is having these symptoms and they feel like they're suffering alone and suffering in silence.
So I think just as we conclude, I just want to reiterate what Dr. Pothoven says, is there's so many patients out there. There's so many women and men out there who are bothered and changing their lives because of these symptoms. And a lot of times it's just understanding what is available and that there are options available. So we hope that if you find that any of these questions or these symptoms resonate with you, please reach out to us or providers that can offer the whole variety of therapy. We are here to help you choose and determine what will be the best option for you.
And I think at this point, we will open it up to the question.
Fantastic. Well, there have been so many questions. Thank you so much for taking your time. I think this was extremely informative. And it seems like there's a lot of people out there who are looking for answers. So I think we have the number on the screen. There's also an online portal, and we have a poll up right now. If you would like to be contacted to make an appointment, please feel free to fill that out. But Dr. Pothoven, Dr. Takacs, thank you so much for your time. Is there anything you want to leave with closing?
I'd just like to say thanks everyone for joining us, and I hope that we were able to give you some good information. And at Urology Center of Iowa, we'd love to see you and help you out and get you treated and get your symptoms under control.
And I would just like to add, clearly you're not alone, because tonight over 350 people had registered for this webinar. And so clearly you are not alone, but do know that there are places to get help. And again, we'd be very happy to see and provide care for you here. But in my world, I just want you to get care somewhere. So seek out providers.
Thank you.
Thank you. Have a good night.